So, good evening, good morning, good afternoon to everybody. I know that you're coming from different time zones. My name is Tal Gibish. I'm the founder and owner of Gibish Consulting GmbH, a boutique relocation agency. We deal with relocation prep, immigration topics, and others of people coming to Germany from all over the world. Today, as part of our monthly free webinars, we're going to host representative of BARMER that I'm going to introduce in a few seconds. We're going to host for the webinar navigating the public healthcare system in Germany, which is a very hot topic. Please, if you have any questions, please write them in the chat and we will address them afterwards. As I said, it's probably going to be longer than a regular webinar that we have because we have a lot of materials to cover. And again, please make sure to keep your mics and cameras off at all times, including the question section. So without further ado, please welcome Dijana Knezevic. I hope that I said that right. And she's the best representative that BARMER have, and I work with a lot. So, Diana, floor is all yours, please.
Hi, thank you for joining me, everybody. My name is Dijana. Tal, you said that perfectly. I am one of the sales representatives. I mainly work with our international clients, making sure to integrate them into the German system, helping them with all their health insurance needs. There are many of us. I'm just one of the many. I happen to work with Tal personally and helping her clients as well. So I do work with the BARMER. We are one of the 94 public health insurances here in Germany. Yes, there are 94. We are also one of the biggest. We have around 9 million members. And today we're just going to go through kind of how the social system here works very briefly, as healthcare is part of the German social system. And then we'll talk a little bit about navigating what to do once you're insured and how the system works with finding a doctor and things like that. So I'm going to share my screen and then we're going to start the presentation. Okay. So welcome to Germany and welcome to BARMER. So as I stated previously a little bit, some of the things that we'll learn today is the Germany's social security system, which insurances do I have to know of? So this is going to be the main social security insurances. Who qualifies for public health insurance? When do I go where? How do I make a doctor's appointment? Your BARMER health insurance card. What do I do when I need to get medicine? And your right as a patient here in Germany, and how to improve your public health insurance coverage, as we do have a private health insurance top off that you can add in additional to your public health insurance. So the German social security system. The German social security system was actually invented in 1880s. Its basic structure has been the same for more than over the hundreds of years. They do continue to improve the system. So today, what we do have is that it's based off of the main 5 pillars, which would be your accident insurance, unemployment insurance, health insurance, long-term care insurance, and pension insurance. How it works is that employees pay a certain percentage of their gross income for each of these insurances, and how much the employee contributes, that's how much the employer contributes as well. So from the employee, for accident insurances, that is completely paid off by the employer. For unemployment insurance, 3% of your gross income is going to be deducted. For health insurance, your 7.3% of your health insurance of your gross income will be deducted, plus a premium. So as I stated before, there are 94 public health insurances here in Germany, and we all have an additional premium that we charge depending on our services. So some might charge a little bit more or a little bit less, but approximately 2 to 4% on top of would be deducted, and that's split evenly between you and the employer, that 2 to 4%. And then long-term care insurance, that goes hand in hand with your public health insurance. So once you sign up for a public health insurance, long-term insurance goes with it as well, and that is 1.275% of your gross income. And then pension insurance is going to be 9.35% of your gross income. So an overview of the Social Security system. As I said, health insurance, that's mainly to cure, improve your health. Long-term care, that's going to be for someone that might be sick for a long time, terminally ill, and they need additional assistance, getting out of bed, household chores, things like that. So you do pay into the insurance in case, if it ever comes to that you can get additional money so you can pay to have these services for you. Pension insurance, that's to pay out your pension, prevention and rehab. Unemployment insurance, so if you lose your job and you're entitled to unemployment benefits, you receive usually unemployment benefits after working 12 months in Germany. So you're entitled to unemployment benefits. That way you can get paid while you're searching for a new job, and that your health insurance is being paid by the state instead of you having to pay individually. And then accident insurance is to avoid accidents related to work. So if you get hurt, you can be compensated for that. Today we'll just be focusing mainly on the health insurance today, but as I said, once you do sign up for a public health insurance, you automatically receive the long-term care with it as well. And with the long-term care, I also forgot to mention, even though I stated 1.275% is deducted from your gross income, that percentage can change depending on how much children you have. So usually the more children you have, the lower that percentage is going to be, because usually people, the state would assume that you have more people to take care of you if you have more children versus if you're just living by yourself. So Germany versus other countries in health insurance. So health insurance in Germany is mandatory, and we actually have a dual system. So one would be the public, and then the other option would be full private insurance. While with other countries, it might be optional or it's limited to certain groups, maybe only people that are employed. Who pays? In Germany, contribution is always income-based. So it's people that are receiving income within the public health insurance. Private health insurance works a little bit differently, as they will look at your entry age into the private health insurance, your health status, and then the kind of tariff that you choose. As with private health insurance, you can have choose kind of the level of coverage that you want. With the public health insurance, it's standardized, so everyone is getting the same level of coverage. Now, contribution is going to be based on your level of income. Other countries, it could be individuals' ability to pay. Some pay out of pocket. It could be deducted from salary. It could come from the taxes or the state. Some have it automatically upon birth. So this all depends. Coverage level. We have a really strong system, whether it's both in the private or the public sector. The public will give you comprehensive and standardized benefits, but all medically necessary treatments are always covered. And I'll get into a little bit of detail later on what that means, medically necessary. And then with the private, I said you can pick and choose how much coverage you want. So some private health insurances even give a lot more coverage than what you have in the public. But what is good for the public, if you don't qualify, if you want to be in the private and you don't qualify for the private, is you have the additional top off private health insurances that you can have in addition. Other countries, it could be a little bit more limited. Not everything could be covered. There's only certain aspects that are covered with your public health insurance. Access to treatment. One of the great things about Germany in general, especially with a public health insurance, almost all healthcare providers work with public health insurances. So you can visit any of them that work with public health insurance. They will take your health insurance. So it's not just I work with a BARMER, I have to go to doctors that work exclusively with the BARMER. No, you can go to any doctor that is willing to take public health insurance or hospital, and most of them do. If they don't, usually it'll be stated as we're a private only doctor, but most of them do. Most of the time when I see that doctors work only want private patients exclusively, might be some dermatologists and more aesthetic reasons. Waiting times. A lot of the times, when you're in the public health insurance, waiting times can be long. In Germany, it's moderate and manageable. I don't want to say it's always short waiting periods, but because you have access to so many doctors, you can find one to get a little bit of a quicker appointment. Usually with general physicians, this isn't an issue. Most of the times when people see longer waiting periods, it's for the specialists. And then family coinsurance in Germany, family members who aren't receiving an income are insured for free. So for that one deduction from the salary, they are insured. So that would be spouses and children. And then with other health insurances, usually people have to have their own. So this just always depends on the country. I generalized it a little bit, but Germany does have a family health insurance policy where family members are free of charge. Individuals who qualify for public health insurance in Germany. So these are employees, students, apprentices, self-employed or freelancing, and this is if they were previously in public health insurance within Germany or the European Union. Because the way the social security system works within the European Union, they're all sort of connected, and it doesn't work that with people that are coming from outside of the EU. Since there was no previous contribution to the social security system, we unfortunately can't accept people who are self-employed or freelancing from outside of the European. And this isn't just a BARMER specific, this is with all public health insurances, as we are regulated by the state and another third party. So they're the ones that are actually in charge of the approval process and not us ourselves. And then, as I stated before, family members who are not employed, they can be insured at no additional costs. That is why there is a dual system. So the alternative would be the private health insurance. Private health insurance is open to employees as well who are earning above 77,400 euros per year. And there's always a minimum limit of how much you can earn. Anyone that's earning above that amount, they can choose to be in the public or go into the private. But usually once you are in the private, it's really hard to get back into the public. That's why self-employed and freelancing, they're welcome to the private health insurance system, and then civil servants as well. I stated previously, private health insurance cost is not based off of income, but entry age, health status, and coverage. Health status might play a big factor in how much you are paying for your health insurance, because they can increase monthly premiums if you have certain health conditions. But your public health insurance does a lot of things for you. As I said before, anything that's always medically necessary will be covered for you. So that includes doctor treatments, dental. Compared to other countries that have dental separately from their health insurance, dental is a part of your health insurance here in Germany. So you don't have to get a separate dental plan. Medication is covered, prevention and checkups. So preventative care, For women, usually, if you're going into your like yearly gynecologist checkups, those are free of charge. Sick pay in Germany for the first 6 weeks, if you happen to be sick, so these are 6 consecutive weeks, you're still going to be paid by your employer. If something happens and you are sick for longer than that period, then what happens is your health insurance actually takes the role of the employer, and they're the ones who continue to pay you even though you're going to be sick. This is normally about 70% of your gross income. Hospital treatments, physical and mental therapy is also included, pregnancy and birth, including midwives and everything along those lines, that's also covered for you. Rehab, dentures, and then you get lots of extra benefits and services within your public health insurance. So they do tend to give out bonuses if you're taking care of your health, if you're physically active, and each health insurance has different bonuses that they do give to their members. So when and where to go. Usually, if you're sick or something happens, you go to a general physician. If a general physician thinks that they can't help you, they'll refer you to a specialist. You have their own set opening hours where you can go and visit and make an appointment. If you have a situation where it's urgent but non-life threatening, let's say it's a weekend and you have an extremely high fever, you can't get to the emergency room, there's a number 116117 that you can call at nights or during the weekends, and they will provide doctor services for you. And then, of course, if it's life-threatening, you can always call the ambulance at 112 or go to the nearest hospital, depending on the situation. Okay. How to set up doctor's appointments. Okay. First, you want to find a doctor. Finding the right doctor, they're going to be your first person of contact if anything is wrong. As I said, most primary physicians work with the public health insurance, so you can pick and choose who your doctor is going to be. You would most likely want them near your area just in case something happens to you. And another helpful tip is if you have any health issues when you're moving to Germany, to bring those files with you so you can so they can have a look at your medical history. There's also specialists that you can go to, but your primary physician will have to give you a referral to see a specialist. Okay, that is how your public health insurance will pay for you to go see that specialist. Now, there are certain specialists such as dentists, gynecologists, things like that, where you don't have to have a referral. But for the most cases, you do need a referral to see a specialist. One thing that the BARMER does have in helping you find a doctor is the BARMER Doctor Finder search. So it's basically a search engine to where you can click and choose the type of doctor that you might need within your location, and then you can choose a preferred language. As BARMER does offer mainly English speaking services, but we also offer services in 17 other languages. So if English, let's say, is not maybe the most comfortable language for you, you can pick and choose doctors that speak other languages that might make you feel a little bit more comfortable. This is nearly from the BARMER, so you can choose, you can use that as a reference, and then go on Google and see reviews, see if the doctors are well liked by people that have visited them. And another thing is that the BARMER does have is the BARMER Teledoctor app. You still have to find a general physician, but this is in case, let's say, the doctor doesn't have an appointment with you, they don't have the time to make an appointment, or maybe you can't make it to the doctor when they do have an appointment. So the Teledoctor app basically allows you to have video consultations, and they can diagnose, treat, and give out prescriptions or sick notes, all from the comfort of your home. So this is available to you 24/7. They provide digital skin checks. If you're having any kind of reaction, there's a medical advice hotline to see if you need to go to the ER or anything along those lines. They can schedule appointments as well. So this is, as I mentioned before, sometimes waiting lines for specialists can be long. I don't want to lie to you, it does happen. So the TeleDoctor app can assist in finding and scheduling appointments with nearby specialists. So we aim to reduce that waiting period as much as possible. And then you can use it to get a second opinion. So let's say if your doctor gives you one opinion, but maybe you want an opinion from another doctor, you can definitely do that with the app. This is a great in addition to your general physician, because the app can't do everything. If you have to get blood tests and things like that, you have to do that on site, and it can't be done through the app. But it's super helpful, super convenient, and it's also available in English. So it's available in 2 languages, German and English. I have it. I use it pretty regularly, especially I have a little daughter who manages to hurt herself all the time. And it just happens to be that it's time when her doctor isn't available because it's a weekend. Setting up appointments. So most doctors will require that you make an appointment to visit them, and they have consultation hours. Quickest way is to call and schedule an appointment, but there are now you can do it online. Most of them have websites, and they work through a website called Dr. Lib, where you can schedule the appointment online and get a direct confirmation. There are some doctors, not a lot, but some doctors that have open consultation hours, meaning you just simply go as soon as you can, you go there, register with them, and you sit and you wait until your turn. But those are mainly the 2 options. Either do it online or calling them directly. Sometimes calling them directly helps because online it's not always updated, and they might be able to fit you in. Your BARMER health insurance card. So once you are insured, you will receive an electronic health insurance card. It has your photo on it. You have to take it to all of your doctor's appointments. They will always ask for your health insurance card, and this is to make sure that they can bill your public health insurance directly. If they don't have the card on site, they can't bill us. And sometimes they will say you have to come back another day. So it's always important to have your card with you, because this is how they're going to know to bill us directly. So you went to the doctor, you gave your card. Now what to expect. You might have received a treatment, you might have received a referral. So this is what to expect, kind of what happens afterwards. You either get medication, or you get a referral to see a specialist. So if you receive a medication, you take your prescription to the pharmacy and you receive the medicine. Okay. Medication in Germany can only be bought in pharmacies. There's no drugstores or convenience stores that you can get medication, even over-the-counter medication. It will be in the pharmacies. What you can get in drugstores or convenience stores are dietary supplements, teas, and vitamins. Most of the time, the prescriptions will already be attached to your card. So you actually just go to the pharmacy and give them your card, and they will have the prescription and they will have the medication ready for you. If you receive a referral, you take the referral with you when you go to your doctor visits. You call, schedule the appointment in advance. You let them know that you do have a referral. Most of the time, they will ask you what it says on the referral, because it can be very specific, and you have to take that with you. So they will know to bill the health insurance directly. If you do not have a referral, then By that technically means that you don't need to visit the specialist. It's not medically necessary for you, and then that your public health insurance won't cover it. But if you have the referral, it will be covered. Prescription and medications. So there's three kind of prescriptions that you can receive when you are at the doctor's. Before, and I'm going to say in the last maybe 2 years, they've switched to all the prescriptions being on the card. So before, you would receive slips. If it was on a red or a pink slip, these would be your normal prescriptions that are necessary, that you can't purchase yourself, that you really do need a prescription for. They are covered by the public health insurance, but there might be costs attached to it. Okay, so it's a €5 minimum and a €10 maximum per package. Now, if prescription is necessary, you have to have a prescription to get the medication, it's going to be on your card. The next kind of prescription that you can receive is a green prescription. These are going to be your over-the-counter medication. So this medication can be bought at the pharmacy without any doctor's prescription, but it's mainly given out as a reminder so you know what to get, or you can just give it to the pharmacist directly and they'll know what to get you if maybe you forget the name. Over-the-counter prescriptions are not covered by the public health insurance. So they are a recommendation, but technically not medically necessary. And then blue prescriptions, which you might not see very often. These are private prescriptions. They're used for medications that are not accepted by public health insurance for the intended purpose. So not covered by public health insurance. I'll use myself an example where you might see this. I went to my dermatologist. I had a lot of issues with acne. They prescribed me a medication for my specific acne. Because acne technically isn't like a medically necessary issue for me, it's more of an aesthetic. This was a private prescription. My public health insurance didn't cover it, but my on top of private health insurance did cover it. So I'll get into that a little bit later. Co-payments. I've mentioned a little bit with the medication. There are some out-of-pocket costs. You might see some additional out-of-pocket costs on certain services. And these are going to be medication I've discussed, hospital treatments. So any treatment in the hospital will be covered by your public health insurance. But food and accommodation is not covered, and it's €10 per day of a maximum 28 days. So let's say someone that has to stay in the hospital for 32 days, they're only going to be paying for the 28 days, so maximum of €280 per year. It's not that much. Now, there might be times where you have the option. This is all depending on the person. If they want to pay a private room, they can do that out of pocket costs, or maybe you have a on top of private health insurance that will cover that. But for most people, it's €10 per day. Physical therapy, €10 per prescription plus 10% of cost. So one prescription gives you 6 sessions. €10 for the prescription, and then plus an additional 10% cost. Again, I will use myself as an example. After birth, I had to go into physical therapy as well. I had 6 sessions. I paid, I think, €30 for all of the 6 sessions. So it's not a lot. Most of the time, I will have to say, is if there are out-of-pocket costs, they're usually not a lot. And then ambulance rides, €5 minimum, €10 maximum. And this is just going to depend on your location and how far the ambulance has to go. Your rights as a patient. So some things that you have to know when you are coming to Germany and being treated is if any additional costs regarding your treatment come up, you have to be informed beforehand. So let's say maybe your doctor wants to run some extra tests that might be not covered by your public health insurance. They have to let you know this isn't covered by your public health insurance, and it's going to cost this much. They will always let you know. They always know the costs. Each treatment always has a price attached to it, and all the healthcare providers know this and what this cost is, and they have to let you know. You can inquire about any documentation regarding your treatments, any kind of lab work that you want to know, any kind of test results, anything that you want to know about your treatment. You have a right to know as well. You have the right to be informed and educated about health-related topics. Any kind of questions that you might have for your healthcare provider, you can ask them. They are required to give you as much information as they have. And then lastly, and most importantly, is the right to self-determination. That means that a medical measure may only be taken after you have given consent for it. So only when you say, yes, I want this treatment, yes, I want the surgery, yes, I want so and so, only then you can receive the medical care. If you say no to something, then you cannot receive it. Okay, so it's always up to you to decide whether you want to do something and how you want your health to be treated, which is why it's always good to sometimes get a second opinion, and then you can form your mind on what you want to do in regards to treatments. And then lastly, it is important to know that doctors can refuse treatments of patients, but only if they have a good reason for it. So most of the time, what can happen is you call in a doctor, you say, hi, I'm a new patient, and they will let you know, sorry, we can't take on any more patients. This means that the doctor is maxed out on the capacity. They usually have a limit of how many patients they can take on. And if they can't take on any more patients, that means the doctor is too busy. The reason they won't take on any more patients is because other patients might suffer. So imagine if they're just taking on new patients, they're moving through them rather quickly, and not everyone can get the same level of care. Some they might go breeze through and they won't give them the right amount of attention. Second thing is the relationship of trust between doctor and patient is disturbed. So that can mean various things, but if let's say you're not trusting of your doctor or something happens that you jeopardize the relationship between your doctor, this can work both ways. Then they don't have to treat you further. If the doctor has no expertise in the requested area, then they will refer you to a doctor that can help you. And then lastly, as you have no proof of insurance, whether it is public or private, they can say that they don't want to treat you. And now I will talk about the additional health insurances on top of your public. So there's 3 types of the additional private health insurance you can get. So this might be for inpatient. These are your hospital overnight stays. Basically, what this does is allows you to have a private room or 2 beds in a hospital room. This depends on the kind of plan that you choose. If you solely want the private, then that's the one you go for. In Germany, the rule of thumb is that there can be no more than 4 patients in 1 bedroom, but some people like to have their own privacy within the private, or maybe they just would prefer one other person to stay with them. And they will also pay in addition to the room and food and boarding, so you won't have to have those additional costs. Outpatient, that is whenever you're going to get those regular doctor visit checkups, or you want to go see a specialist, so you're not going to be staying overnight in any healthcare facility. So this can go for osteopathy, dermatology, medications allowed only on private prescriptions. You can have the availability to be treated as a private patient, so can speed up waiting times sometimes depending on the doctor, and glasses as well. So these are things that are generally not covered by your public health insurance. This is like the outside care that you can get, so it is covered for you. And I will say that with glasses, so the glass itself is covered by your public health insurances, however the frames are not, and you can get additional coverage on that to cover the frames as well. And then lastly is your dental. As good as the public health insurance system is, I will say that dental tends to lack a lot in the coverage, and it varies. So things like dental cleanings are not generally covered. If you have to take out a tooth, that's going to be covered. Regular checkups will be covered. Percentages of crowns and implants are covered. Dentures, that can be covered as well. Things like teeth whitening aren't covered. And professional dental cleaning, I just realized I put teeth whitening twice on there. But you do have coverage on the dental. It might not be full coverage, and it's always good to have that dental health insurance on top of the public in case something happens, because even within the public health insurance, if we are covering crowns and things like that, you do have different level of quality of crowns. So the higher the price, you might not get as much coverage on that. We only cover a certain amount of percentage. I would say an average of 60 maybe percent. But if you look at, for example, crowns that are 2,000-3,000 euros per crown, you still have quite a lot of out-of-pocket costs, and this is something that can help cover that additional charges. There are 34 private health insurances here in Germany. They all provide these additional health insurances as well. Us, the BARMER, we do have an official partner, that would be the Hook. So we can provide our members a little bit of discounts regarding these additional private health insurances, and they also provide other health insurances like liability, legal aid, and things like that. But in terms of your health insurance, that is our official partners. And then depending on your sales consultant, you can also ask them, they can recommend other private health insurances as well. And I believe that is it. So now it's time for questions.
Okay, so let me also open my camera and we share the screen. Just a second. Yeah, okay. Okay, so to be fair, thank you very much for the presentation. A lot of information. We had also questions in the chat in the meantime, but to be fair, we also had questions in advance that we received from people that we will address one, I think, or two first, and then we go to the chat. Please, if you have any questions, write them in the chat and we will answer. The first question is about therapy. Psychologists, psychiatrists, are they covered by the public insurance?
They are. You will have to get a referral from your general physician. It's really not hard to get the referral. If you are struggling in any sort of way, they will be happy to write you a referral, and then it is covered by your private health insurance.
Okay. You mentioned
or public health insurance.
Yeah.
Excuse me, public health insurance. Yes.
So you mentioned before the switching between the private and the public. How many years, when you're in the private insurance and you want to switch to the public insurance, is there a limit of years of how many years you're in the private and you're not allowed to switch to the public?
Oh, this is a little bit of a tough question. So once you're in the private, you're pretty much in the private. If you are employed and you're earning over this threshold, the threshold changes every year, okay? They always increase the threshold. Last year it was 73,800 euros, and then this year it's 77,400
400.
euros.
Yes.
Right? So people that are previously were qualified for the public health insurance, and because this threshold increased, they have to go back into the public. But people who are still earning over that amount, they have to stay because it was their free of choice to go from the public to the private. They're no longer paying into the social security system. That's one of the main reasons is they look at payment into the social security system. If you're not paying in, you don't receive the benefits. So once you are free of choice to go, you are in the private, it won't matter how many years you're in there, you just can't go back to the public unless something happens where you're earning under this threshold. If you're a freelance, let's say self-employed, how you can get back into the public, let's say you've been in private for years, you would have to go from being self-employed, freelancing, to employed, earning under the threshold. That would kind of be, it's really, really hard to go back into the public, and that's the one part I will not lie on. It's extremely hard to go back into the public. The other thing is there is a cutoff age, 55 years. Tal, I know you're laughing because we've had these issues.
That's the topic.
But it was funny that I received we had this discussion today, and a colleague of mine also had the exact same question regarding this cutoff age limit. So before there was no cutoff age limit, but now the cutoff age limit is 55 years old. If you are not in the public health insurance, we cannot put you in the public health insurance. Why that is, I'm not 100% sure. I believe it has to be with that payment of there is no previous payment into the public health insurance system. So unless you're coming from a European Union country, and you're getting to that age where you're about to be in retirement and you haven't contributed enough to receive the benefits that you will have in the retirement age for the public health insurance system.
So that is a topic that comes a lot, and it changed only in the last year, I think, because before that, I basically sent tons of people to sign up for the public health insurance. And that actually answers the last question that we had here. Citizen over, dual German-American citizen over the age of 65 who has never been employed in Germany and comes from the US with the private insurance, I assume. So it means that the only option is private health insurance.
Right. And I will say sometimes it can be on an individual based cases. So if at any point you might have been in the public health insurance in Germany or within the EU, there can always we have to send that off for further evaluation. So it's not up to us, but there are forms that we can fill out. There tends to be a lot of people that lived in Germany prior, were once in the public health insurance systems. They've been gone for a really long time. They want to come back. And those are things that have to be evaluated. There is a form you can fill out, and then we have to send it further. And basically it's the third party that decides whether it's okay or not.
Which is very important actually to note that sometimes the public insurances, they're not the last stop at the decision. No. Even after you apply and the public insurance says, okay, you're fine, then it goes to review to another authority and they actually decide if yes or no. So you can get the yes from the public health insurance, and then upper or higher review would say, no, we're sorry,
Yeah.
and we actually had
Yeah,
that, unfortunately.
that's important to note that we are a public health insurance, so we are a government regulated health insurance. So there's always a third party making sure that we are following the rules that are set by the government, and that we can't make any exceptions, because there are 94 public health insurances here in Germany, and let's say if BARMER is the one that's making the exceptions, but the other ones are following, then the other ones are going to be making their own exceptions, and it's just going to create more chaos.
Yeah, and chaos we don't like in Germany.
Yeah, no,
Um,
not at all.
let's go actually to and try to divert a little bit from the age, to a very important. One of my family members is unemployed and is insured via my public health insurance since I'm employed. What happens if they become freelancers? Can they join public health insurance on their own?
Yes. Because they are already in the public health insurance, even through the family health insurance, they have a right to have a public health insurance in themselves once they are freelancing. So they're already in the system. As long as you're in the system, you can stay in the system.
That's what I say to people. It's very hard to kick you out of the system. Just get into the system. That's
Just
the
get into
point.
the system.
Which actually leads me to a question. If, let's say, over 65 but employed, can they access the public system?
I believe not.
Okay. Okay. Next question. If I don't have a job when I arrive, okay,
Mm-hmm.
let's go to the clarification. It would be better. I will likely return to Germany. I assume she's an American. Before having a job for family reasons, I will need health insurance while I search for a job. I believe I need to pay for my own public health insurance until I'm employed. Is that correct?
No. So while you are looking for a job, and sorry, I don't mean to sound harsh. Usually in those cases, we just don't have any grounds to insure you. So you're not employed, you're not, it's basically like no status at the moment. And what we do recommend is always getting like an expat insurance. Those are good for the short term, so usually up to a year that you can have those on. The most popular one tends to be Malvista. Um,
Which is a horrible, horrible insurance. That's my personal opinion, but I see,
yeah.
experience of
But for
years. It's
the
one of the
most
worst.
popular one tends to be the Malvista, what a lot of people choose, and it's only meant for short term. Where people get into trouble is they want to use it for long term. But for short term, until you find a job that's going to be, I think it should be fine enough to get you through that. So it's only intended for like a maximum of up to a year. And there's usually other incoming health insurances that you can get to get you through that period until you can qualify for the public.
What about a spouse?
Mm-hmm.
It's not related, like unemployed spouse over the age of 55. Spouse to someone who is employed and in the public system. Would that count?
I believe yes. I believe yes, but I'm not 100% sure, but I would believe yes, because spouses do have that family, that it's technically not their health insurance, they're relying on someone else.
Okay. Now there was a question on of artists, and it reminded me a question that we actually received in
Mm-hmm.
advance. Can artists who are freelancers in general
Mm-hmm.
can apply for public health insurance while they are waiting for KSK approval? And is it worth it for them?
Right. So once you are approved by the KSK, they're always going to ask you to submit a health insurance because there are technically the KSK works as like a employer of sort. So you do have to have a public health insurance with them. You can you can choose the BARMER, you can choose any health insurance of your choice, but you do have to um, set that you do have to give them a health insurance. Now, where the issue comes in, you can apply with the public health insurance. We would technically, how it would work is we would set the starting date to be on the date of the application. So that's when your theoretical health insurance would start. And the reason I say theoretical is because if the KSK does not approve, then technically you're not insured. And you're not insured until your the KSK gives that approval. So you're basically in this provisional phase. Okay. They will pay back. They will pay back. So let's say you applied today and we set your starting date today. They will pay back. So if you had to go see the doctors in the meantime, you can get that submitted. We'll take it care of. But if they do say no, then you technically don't have a health insurance. So it's kind of a sword with two edges. It works good and it can work against you just depending on their approval. But at the end of the day, um, you you do have to have a health insurance if you are under the KSK. The other option you can do is wait until their approval. So once they say, okay, good to go, then you can also apply then and there. Because I know with the KSK, sometimes it's a long waiting process, as it is with all things in Germany.
Yeah, I think Sky is the average time for an answer
Yeah.
is 18 months.
Oh, wow.
Yeah,
It used to be shorter.
it used to be. But many artists are coming, so they get a lot of demand there.
Yeah.
Yeah, and we have someone in the audience that appealed to Kaiska that they refused. And that actually, if someone is an artist and has a day job,
Mm-hmm.
that gives the person the right for public health insurance,
Mm-hmm.
and the artist earns 10,000 a year, is it worth for them to quit the day job? A very good question, huh?
Yeah. Wait, so they have a mini job or
A
like
day
a
job, like
a day?
a full time or part time, let's say.
Right. But they're also freelancing and earning more from the freelancing.
I guess they're earning less.
Oh, they're earning less from the freelancing,
Yeah.
yes. Um, well, technically, I mean, you can do both. It's not gonna go right against you.
Okay.
You can
I
still
get
do.
correction here. Sorry, it's midi job. The day job is midi job to earn 700,
Okay.
and from the art they get 10,000 a year annually.
Okay.
So it's more than the art, I guess. It's more the art. Sorry.
Okay. Technically, how health insurances do look at is like your main calling is where you're earning more. But if your employer does qualify you for the public health insurance, then you know I'm not gonna say no. Yeah, if your employer is going to say that you have to be compulsory insured while working with them, then I would stay with that. Now, if you're applying for the KSK separately, then at that point you would just switch over to the KSK, and they would take the place of the employer, and they'll do the contributions and everything else.
Okay, we have a question that actually was asked also in advance, but
Mm-hmm.
I'm happy to ask the question here. If someone comes in with expat insurance, which is FEDER,
Mm-hmm.
and then gets a job in a regular public health insurance, do they have to back pay insurance dues from the day they arrive from the day of Anmeldung, actually?
Oh,
I know that it happened to a few people, not with BARMER, but still with public health insurance. They were with German German citizens, and they were told that they have to get a job, and until they get a job, they and then they had to pay when they found a job. They had to back pay
back
like
pay.
a lot. So is it something that I don't know? Is it something that is normal?
Yes, yes, it is because they usually, and this, it, I've seen people get away with it too. So I've
You're
I've
saying just negotiate your way.
tried to that would be my suggestion. I'm not saying anything legally. um I've seen people get away with it as well, because previously I used to work with private health insurances before I switched over to the public. Um, and I've I've seen a lot of cases. Okay. Um, Technically, yes, you do have to back pay. There's always a little bit of wiggle room that you do have. So it's not like I'm here day one, I automatically need the public health insurance. It is preferred, of course, but um, there is now these chance cards and everything like that. So there is some form of understanding. Um, but from my knowledge, is the I know the Malvista insurance is one that the public health insurance tends to be okay with, and I know you said it's very bad, but um, uh, that tends to be one that they are okay with. Um, it can be on a case by case. I really don't have a straight answer, but yes, you can come into situations where you do have to back pay. So please do not stay on those expat insurances for long, because they are technically only supposed to be used for a short period of time. So not, let's say, 2 years, for example. That's a very long time that you're in Germany, not on a German health insurance. And I say this for visa renewals as well, because insurance is one of the main things that they look at as well, and they want it to be a German health insurance. It comes with because you're paying into that long-term care, you're paying into the German system, and that's the main criteria that they are looking for. Um, but yeah, some people do get away with it. So once they find a new job, and it might just be that they found one faster, but please do not stay here on 2 years on an expat insurance either. I know they are cheaper, but sometimes it will work against you. So the ideal is to find a job as soon as possible. And maybe it's not your ideal job that you're looking for. I know people come in with that are overqualified. Um, Even get a part-time job, anything. Just get into the public system. And then once you find the job that you want, then you're taken care of. But don't stay for a long time on those public health insurances.
Okay, so I think we're gonna end with one last question that
Okay.
I got in private message here. Yeah, I get it. It's a sensitive topic. Um, for chronic illness
Hmm.
of an adult, a parent, let's say, they have kind of like no, do they have like, they don't have to pay the extra 10 euros per medication or something like that?
um uh, for chronic illnesses, I believe yes. I'm not 100% sure. I know children, they do not. So children under the age of 18, for things like chronic conditions and things like and medically necessary medications for children, they definitely don't have to pay. For adults, I'm not 100% sure. I know there are certain medications that you don't have to pay. I know there's certain antibiotics that you don't have to pay for, and things like that. I'm not 100% sure. I can, I would have to ask a colleague, and then maybe get back to you with that. Would that be a
Yeah,
better?
I know the person, so that's okay. I just
Okay.
maybe
So
added question to
I will
that.
let you know.
Yeah,
I will let you
maybe
know,
added
Tal.
question to that if that that the kids can get also the same with no chronic illness. The chronic illness is only of the parent. So I think that by that we're going to close this session.
Okay.
Thank you very much for all the information, for
No
everything
problem.
that you do for us. It's very, very exciting. Thank you for the people who um, managed to stay until the end and take the time to listen and to learn about the system. And we hope to see you soon in Germany if you're not here yet. And thank you. And hopefully for the Berliners, I'm going to see you in the bureaucracy quiz that we have in next month. So thank you very much.
Thank you as well. Thank you, everyone. I hope you learned something. I hope I didn't scare you too much. I'll be honest and say it is a little bit of a complicated system, even for Germans. Okay, so even for Germans themselves, but don't be too afraid. Um, it is quite a good system, I have to say. I come from the U.S., so um, everything over there is private, but it is quite a good system. It's not perfect, but we are here to guide you. If you're coming, if you're working with Tall, if you're going to be insured through me, I will help and guide you. I do make myself available as much as I can, and I try to help out as much as I can. Um, and let's say even if you won't be insured with the BARMER, there are other health insurances that provide English speaking services, but always make sure that you find someone that's going to be there and help navigate you, especially if you're someone that's going to be using the healthcare services. I think that's also very important because we're all our health statuses are very, very different. So some might utilize it a little bit more. Some might not use it at all. My husband, for example, he since we've moved here, he's used his health insurance like once.
I use
But
it all the time. I'm like a constant, like a frequent flyer of of the system here. I'm a fan of the public system, but
I am
I do
too.
agree.
I
You have
I
to
am
know how to manage it.
You do have to know how to manage it. I really am a fan of the public health insurance, and I've worked with private health insurances before. And I'm not saying, I don't want to say that they're bad, because I think both the public and the private have their pros and cons, definitely. But I am a really big fan of the public health insurance system here in Germany. I think it works quite well. I know how in other countries, not all countries, of course, how public health insurance systems work, and it is a lot worse. But here, because so many healthcare providers are open to you, you just have to work your way around the system. But if you have a sales consultant that you can reach out to, they will most of the time help you. I've helped clients, help them find doctors, help navigate them as much as I can. Of course, I'm here in Munich, so I can't technically help with finding doctors in Berlin, but I can give you the tools and resources from the BARMER. Um, and yeah,
Great. So thank you very much again.
thank you.
And thank you people for staying. You know, it's longer than a year's webinar, But thank you very much and have a pleasant evening, day, morning, and see you soon.
See you. Bye.
Bye bye.